Hello everyone, my name is Virginia Allam. I'm going to talk to you today about the Occupational English Test Speaking section, structuring the role play. Role plays in the OET Speaking test are designed to be like conversations that you might have with patients or patients' relatives. But remember that you do not need to describe complex procedures or have extensive medical knowledge. It is still a language test. What you do need to do is to communicate information in everyday terms to a member of the public who probably has limited medical knowledge. At least this is the part that the interlocutor will play. The speaking test relates to your profession, so you need to think about the sorts of things you are likely to have to communicate. What are the common conditions in your profession? For example, in podiatry, you might be talking about diabetes and foot care, tinea or athlete's foot, the use of orthotics. In speech pathology, you may talk about dysphagia or difficulty swallowing, speech difficulties, stroke rehabilitation. In radiography, you may talk about the different radiology tests, fear of claustrophobia, for example, in an MRI, and the risk of overexposure to radiation. Dietetics, you might talk about weight loss, obesity, nutrition in the elderly, nutritional deficiencies. In occupational therapy, perhaps you might talk about mobility aids, home assessment, home modification. So remember that each role play lasts around 5 minutes. You will find that the tasks on the role play card guide you in the role play. Look at this basic plan for a role play. Firstly, introduce yourself and explain your role. Second, find out more about the problem. 3, explain the condition or a test or a procedure or a new medication. 4, give advice or make suggestions. And then 5, use other communication strategies, for example, reassuring, reinforcing the importance of doing something, or empathizing. And finally, round the conversation off. Generally, most role plays focus on finding out about a problem and then explaining what needs to happen. If you look at a few examples of role plays, you will notice that most start with a find out more about task. This is where you ask the patient to explain what is happening or what the problem is. For example, can you tell me a bit more about the problem? Can you tell me what's been happening lately? That can you tell me about or can you tell me a bit more about is a way of asking an open question. This task also gives you the opportunity to do a few more things. You can display some non-verbal communication, like nodding your head to indicate that you understand. You could use some listening noises, like, okay, I see. This indicates that you are actively listening to the other person. You could also confirm understanding by summarizing. So what you're saying is you've been having trouble sleeping for a while now. You've put on a bit of weight and your wife says you snore at night. Is that right? The next thing you will do is to give an explanation about something. It may be a condition. For example, I'll explain what happens when you have a stroke. Sometimes blood flow to the brain is blocked. This means that parts of your brain don't get enough oxygen, and this results in a stroke. It's a good idea to spend some time preparing this part of the role play before the test. Make sure you're able to explain common conditions which you come across in your profession and explain them in simple terms. Keep in mind that it is not a medical test. It is a test of your language ability. When you explain something, only use a few sentences and keep to everyday language if possible. You may also be asked to display some more complex communication strategies, like giving advice, making suggestions, reassuring or empathizing. In giving advice, you need to consider softeners or softer expressions to give advice more politely. For example, if you are giving advice, it is better to say, "It would be a good idea if you lose some weight. It would help a lot if you could exercise a bit more," rather than "you should lose some weight" or "you should exercise more." Softeners like "just" are also useful when giving advice. For example, "I'll just explain about the MRI so you'll understand what will happen tomorrow." Finally, try to anticipate what the interlocutor may do. They will often add something to make it a little bit more difficult for you in the role play. For example, be difficult and refuse to take advice. For example, a young patient who wants to go home after having a baby and doesn't want to wait for blood test results. Be reluctant to follow treatment. For example, a woman who can't see the point of having dye in her eye every day to check it. Be defensive. For example, about a dietitian asking you about your eating habits if you are a little overweight. So I hope that these hints will help you to prepare the speaking test. If you keep to a structure, you will find the speaking test a lot easier, and it will be a lot easier for you to anticipate what the interlocutor may throw into the mix when you are doing the role play. Remember, keep it relatively simple as you are explaining to a member of the public who doesn't or may not have medical understanding. And remember, above all, that this is a language test. We want to know how well you can manage communication strategies.